All right, I know people are still coming. Good afternoon, everyone. Sorry, just getting settled, being back in conference in person, plus doing a hybrid, it's a little tricky, so we're, we're figuring it all out. Come on, have a seat. Be a good session. It's gonna be a great session. All right, so we'll go ahead and get started since it is 3:30. Again, thank you all for joining this session. This is Continuums of Care, taking action to address racial disparities in homeless systems. We do also have a panelist who is virtual, so we're gonna kind of go back and forth between he'll be on the screen in a moment, and then we have the rest of the panelists here. My name is Lahela Maddox, and I am the COO of the Regional Task Force on Homelessness in San Diego. Super excited to be here after a long 2 years of being away and in person. The last time I was here moderating a session also on Continuums of Care and how they were implementing the Homeless Emergency Aid Program funding from Governor Brown a couple years ago. So really excited to be here today with some amazing panelists and leadership from San Francisco, San Diego, and Los Angeles. And we are here to kind of talk about addressing racial disparities in our homeless response system. It's well known that Black, Indigenous, and people of color are overrepresented among those experiencing homelessness due to systemic racism and a history of oppression in our country. Many continuums of care across the country, and specifically here in California, are undergoing activities to address racial disparities among those experiencing homelessness, including exploring their local homeless data, analyze access to housing through coordinated entry systems, and ensure those with lived experience are full participants in system planning and decision making. This session is going to highlight the work of 3 communities, again, San Diego, LA, and San Francisco, who are all actively working to promote equity through policy, advocacy, data, and shifting homeless system practices. But they are all in different stages of this process. Panelists are going to describe their unique approach that each continuum of care is taking to address racial disparities among those experiencing homelessness in their communities and how they are shaped by local factors. Each panelist is going to discuss how they are using the CoC structure to take action by convening local committees, analyzing homelessness and other sector data, listening to the voices of those with lived experience, and advocating for policy change. Our plan is that they're each going to take about 10 minutes to kind of talk about their communities, and then we're going to open it up for a discussion with all of you to really talk more about how we've come to understand, what we've come to understand from the data and people's experiences, and then how to turn it into action. For those in the room that are developers, we want to know what it means for your companies and how does this become embedded in your work as well. As leaders, we must be consistent in our action and with our commitments if we expect others to trust us and to let us lead. Along with consistency, we must be prepared for the long haul. Equity work is not a one and done. What can you do and what are you willing to commit to doing on a regular basis to invest in your organization and your community, and why you should connect with your continuum of care? So we are going to start with Mr. Clifton Trotter, if you want to introduce yourself, and I will advance your slides for you.
Thank you so much, Lahela, and I want to thank also to everyone that's involved in technical support for making this virtual opportunity available for me. I want to thank the panelists as well and everyone in attendance. My name is Clifton Trotter. I am the Racial Equity Director for the Los Angeles Homeless Service Authority. Been in the role for a little bit over a year. In today's presentation, I really want to talk about sort of where we're at in terms of our critical racial equity initiatives, not only externally, but also internally within the organization. I'll briefly talk about the ad hoc committee and where that now stands. Also to some organizational audit that was performed by National Innovation Services to really lead the charge for our internal racial equity work. Talk about the key functions of the department, the initiatives, and look at our approach at key performance indicators for the system at large, and then talk about some of the racial equity research work that we've embarked on with the help of other partners, and then really just briefly touch on some lessons learned. Next slide. So the formation of the ad hoc committee. For you guys who probably know or may not know, there's a huge racial disparity in LA County and LA City as it pertains to African Americans experiencing homelessness. In 2017, based on the data from the point in time count, data reflected that despite being around 9% of the LA County population, the representation of homelessness among Black people hovered around 39 to 40%. With the success of the ad hoc committee on women and homelessness, LASA Commission and leadership within LASA thought it was necessary to create a committee specific to Black people experiencing homelessness. That committee was charged or developed 3 purposes that they felt were significant in terms of comprehensive analysis of the system, and really leading the charge to mitigate homelessness. So examine the factors contributing to the overrepresentation of Black people experiencing homelessness was one of the purposes. 2, identify opportunities to increase racial equity within homeless service delivery. I see there is something in the chat not seeing Clifton's slides. Okay. Are we all good? Thumbs up. Can folks see the slide? Can I get a confirmation in the chat? Thank you so much. That's better for me as well. 3rd was to develop recommendations to more effectively meet the needs of Black people experiencing homelessness. So over the course of this committee, at the conclusion of the committee's work was the development of 67 recommendations to really advance equity throughout the system, through our system partners, through coordination, and also through policy efforts. Next slide, please. So as mentioned, the 2017 point in time count revealed some very staggering numbers as it relates to Black people experiencing homelessness. The most official account that we have until we have the data finalized for 2021 is the 2020 point in time account, which still reflected huge disparities. There was a decrease, in African Americans in terms of their population count in LA County, but the disparity remained roughly the same at 34%. So we recognize that there are still some structural inequities that exist that are continually affecting Black people experiencing homelessness, and we will continue to use the data to help us find solutions and strategies that make sense. Next slide, please. As mentioned, we partner with National Innovation Services to conduct an internal organizational audit as it relates to racial equity. I think it's very important that if we're going to do this work, we need to clean up our house as well. That report revealed 3 priorities that we are now embarking on as an organization: shifting culture in small and big ways, investing in transformative relationships, program policies and designs, and also to build, to be equitable in equity in policies and practices. So really focusing on organizational accountability as it relates to the work. Next slide. Key functions of the department, and I think it is important for me to really touch on the point that the creation of the equity department in my role is really a testament of the work of the ad hoc committee. And so as such, these were key functions that I developed with leadership that I thought were important to really drive diversity, equity, and inclusion for the organization. 1, assessment, really understanding the data, defining out the data, understanding how that data is being sourced, gathering that data from employee engagement, and also 2, in community engagement, and then incorporating best practices around equity to really operationalize equity internally and to be in better footing as we think about it from a systematic standpoint. Part of that was the development of LASA Equity Committee, and also 2, really refining and expanding our lived experience advisory board and making sure that we're gathering input and using some of that internal expertise to drive development in the organization, strategy development, and really bring those recommendations to the foot of C-suite and make sure that they're accountable in implementing them throughout the organization and also the system. Next slide. So current internal and a little bit of external department initiatives going on. As a best practice, we've established employee resource groups. We have 3 groups: the Melanated Mindset, Black Employee Resource Group, Out and Equal, LGBTQ Employee Resource Group, and also the Women's Employee Resource Group. We see these groups as being very pivotal in terms of really expanding our cultural competency, really leading sort of trainings and workshops, and really shifting the culture within the organization as defined from the NIS report. We also institute what we've termed Equity Dialogue Series. As you know, talking about race within organizations can be taboo. Well, we wanted to eliminate that line of thinking. We've instituted these talks, these discussions range from talking about race to intersectionality, to talk about what it means to be Latinx, and really just creating a space to where folks can bring their authentic selves and have conversations with folks represented across the organization, from C-suite leadership down to our frontline workers. We've also established a professional development committee, which is almost at conclusion in terms of developing our professional development program, which focuses on our head workers, which are primarily BIPOC individuals. Again, this is in response to the ad hoc committee report and also to the NIS report, where we felt like it was important to really center and focus on our homegrown talent and providing them the necessary resources to climb within the organization. Also, too, we've established an equity-based decision-making framework work group. This work goes specifically, it's designed to ensure that we have external engagement, not at the back end of policymaking, but at the front end, to ensure that our lived experience advisory board, that our service providers, and also too, folks internally have a say as it pertains to policy. We've just enacted or started our internal ad hoc work group for Black people experiencing homelessness. I am a representative on the ad hoc committee for Black people experiencing homelessness steering committee. This committee is led by the county, specifically the Anti-Racism, Diversity, and Inclusion Office. This is part of our coordinated efforts to make sure that system actors are working together to advance the recommendations of the ad hoc committee. Also, too, we have an internal work group specific to American Indian, Alaska Native work group, as some of you might imagine. Unfortunately, this group tends to be invisible when we start talking about race equity, and based on the data, they are a group that is severely impacted by homelessness. And so from a charge or the board motion presented by the county, we've sort of begun the internal work of having this work group and working closely with the city and county to advance recommendations from that motion. We also have established a HEP frontline listening session. This again gives the opportunity for frontline workers to elevate and amplify their voices and offer recommendations for programmatic efforts to C-suite leadership. We're at near completion of this pilot program, and it's proven to be a success. As mentioned, we have the LASA Equity Committee. This is a representative of staff across the department who ensure that diversity, equity, and inclusion is being presented in our policies and practices. And lastly, we're instituting racial equity trainings internally. We did these trainings externally, and again, they are recommendations from the ad hoc report. Next slide. Diving a little bit deeper into the racial equity trainings. Over the summer, we provided a series of these trainings, which touched on the 5 core topics that you can see there: history of structural and institutional racism, implicit bias, cultural humility, trauma-informed care, and working with LGBTQ folks in the community. The trainings were not mandatory, but still we were able to solicit 96 providers from our network. Over 1,200 participants participated. In many ways, it was a huge success. And because of that, and because of the commitment from leadership, we were able to make those trainings mandatory for staff to really operationalize equity. Next slide. So now we've really transitioned to really thinking about how are we going to really assess our performance measures and what our key performance indicators will be. In order to do that, we need to assess what our current metrics are, what are some of the gaps there, and really make a focus in having racial demographics centered in terms of our key performance indicators. As we develop these indicators and see them out, the hope is that through the implementation, we can find and figure out what's working, what's not working, and from those lessons learned, can completely refine our approach so that we're better year over year. Next slide. Currently, right now, we've partnered with UCLA California Policy Lab to create and implement performance metrics that can be used with various system actors, obviously ourselves, the county, and the city. We've kind of advanced past that first phase. We're almost at the end of concluding the second phase, where we're currently outlining system components and certain methodologies. We plan to test these KPIs fully with system leaders over the spring, and at conclusion, present to the LAHSA Commission, county homeless deputies, and city homeless and poverty committee in the fall. So I think as we develop these KPIs and are really utilizing the research and expertise from UCLA, we want to make sure that they make sense across all system actors and make sense for the whole homeless service sector as a whole, because we recognize that coordination tends to be a hurdle, and we want to make sure that we're not contributing to that hurdle. Next slide. Our coordinated entry system triage tool research refinement project. So this is a 3-year community-based research project, as some of you guys might know or might be experiencing in your various continuums of care. There's issues with the coordinated entry system as it relates to bias, as it relates to prioritization, matching, and what have you. We're currently evaluating the system and trying to find refinements around 3 core components: assessment, administration, and application. We've basically been blessed by the research from USC, UCLA, and California Policy Lab, University of Missouri, and Lens Company that have really helped to allow us to really analyze these 3 components and really determine what is going to be the best approach for SESTR moving forward within our CLC. Next slide. What really came out of this research was understanding sort of contextually what were the drivers. I think there was a consensus among the continuum that the tool itself was unfair, a bit outdated. This research was substantiated from the ad hoc committee and their recommendations to improve the tool. Thankfully, we were able to receive philanthropic dollars from Hilton United Way, the committee, and also to HPRI to help fund this research project. Initially, I think the first phase was really evaluating the tool. Research was conducted, co-created best practices. These practices were really a result of a lot of the recommendations offered from our community advisory board. Some of the things that they recommended was really rewording the questions for which our researchers and their completion for that, and really revising, scoring for vulnerability. I think the VSPIT Act, in many ways, there's more, penalties within that scoring tool than benefits, and I think the research has come to reflect that. Next slide, please. Additionally, we enlisted California Policy Lab to do some more extended research around Black people experiencing homelessness, specifically in permanent supportive housing. We recognize that retention is very much low, and return to homelessness is high. The recommendations that were brought forth from this research group really looked at collecting information about the range of PSH types in LA County, develop a plan for more differentiated PSH systems in Los Angeles County, address the various factors that contribute to folks not wanting to return to permanent supportive housing programs, implicit bias, prejudice, discrimination, all those things that lead to unit acquisition discrimination, and also too, building in a safety network. It was found out in the research that a lot of folks sometimes are being misplaced within their housing types and not being in a safe community that's offering a sense of belonging and public safety. So how do we fund 24-hour services? And then two, reduce case management turnover. Some of you might, be experiencing in your continuums of care, especially too with the onslaught of COVID, the increase in just living expenses in Los Angeles. There's a huge turnover rate within case management. So what can we do to really refine that particular labor market, and what can we do to really mitigate against attrition? Because without having strong case management to support a lot of these residents, they can't have a successful housing experience. And to that aim too, what can we do to develop peer advocate programs to really create a strong pipeline of case management to really shepherd the experience of a lot of these Black residents. And then lastly, to provide sustained services to support transitions into independent housing after exit. So this isn't about just leaving, participants on their own. It's really sustaining the support and creating a true network for their success. Next slide. So as it relates to the ad hoc committee, in August of last year, that committee was sunsetted, but we recognized that there were some key voices and key leaders that needed to still be connected to the work. And so as this work transitioned to the county, and the reason for that transition was we recognized that a lot of the programs and services and the rest within different county departments. And so we've established a steering committee, which is under the purview of the Anti-Racism, Diversity, and Inclusion Office coming out of the CEO's office of the county. The plan is to launch a ad hoc implementation work group for which the steering committee would advise those implementation efforts. Next slide. Lesson learned. So as we have been intently focused on racial equity, it's also understanding sort of the impact of our work. During COVID, folks know about the effort for Project Room Key to really provide safety for folks and really limit the transmission of COVID. What we found in our preliminary data was that a lot of the participants that were being housed were not folks of color. And we realized that we needed to reassess for racial equity. In doing it, I think that really sort of exposed sort of our gaps in terms of our work around racial equity. And for that, we developed a racial equity resource guide that we use internally and provided for our service providers. The guide really sussed out bias and really wanted to define sort of the different components that can come into play that can contribute to not properly assessing or not properly analyzing current data to ensure racial equity within Project Room Key. We also sort of took that frame of mind and used the lessons learned from Project Room Key to really be very strategic in how we prioritize our emergency housing vouchers. We wanted to make sure that we were using tools that essentially can serve as proxies for race. And so we utilized the Cal Enviro Screen, which looks at environmental and geographical factors to as proxies for race. We also used justice-involved individuals to be included as part of our equity scoring tool, and also to those who were chronically homeless. So we understood that we wanted to be very intentional in how we looked at the data, and that we wanted to make sure that we were really implementing proxies that make sense, and so that we can match and prioritize folks in a way that could account for racial equity. As mentioned, the coordinated entry system is something that unanimously has been seen to really not take into account sort of the racial disparities or some of the structural inequities that are embedded, and really try and develop a neutral system And so we, through the research of the various researchers really led by, USC in this work, and then also to the recommendations from the Community Advisory Board, was the rewording of the questions. And so that our assessment was culturally relevant for the groups that were most impacted, and revising the VSPIT Act to also embody that aim as well. Next slide. So sort of looking forward, and this is more specific to my department, is really the development of a dashboard internally within the organization. Again, I think it's important that DEI is being assessed. We want to make sure that we are cleaning our house before we can begin to tell the system how to clean its house. Also, too, we want to offer support for a lot of our frontline staff who may incur racial or emotional abuse in different ways. And so really providing a clinical support program to support them in their work. And then to develop a racial equity plan. So we think this is going to be real significant in terms of just, bringing communities into the fold, getting community input on racial equity goals that make sense, getting input from our system partners as well, and really developing out a racial equity plan that makes sense. And so the other stuff that you hear is just me thinking about, what's going to be significant for my department, maybe having a dedicated analyst to really look at our data to make sure that we don't have to, keep reassessing, that we reassess correctly the first time, make sure that we can build in to potentially a program analyst that can really look at some of the programs and our service providers that are instituting them, and realize what are some of the gaps that they may have in capacity, what are some of the gaps and challenges in how we award contracts, and make sure that we are providing opportunities for some of our smaller BIPOC organizations to be able to do some of the culturally representative and relevant work in the community. And then lastly, I think I touched on this a little bit, really the institution of our professional development program, so we can elevate the work of our frontline staff. So that concludes my presentation.
Great, thank you so much, Clifton. Next, we're going to be joined by Cynthia, and I'll let her introduce herself. But in the meantime, while she gets ready, if you're joining us virtually, make sure you put your questions in the chat. We are watching that, and we'll address those questions later in the presentation.
Thank you. Oh, I'll just do it. Thank you. Good afternoon, everybody. Thanks for being here. My name is Cynthia Nagendra. I am, I've switched roles recently, so I'm still getting used to my title. I work for the Department of Homelessness and Supportive Housing in San Francisco. I'm a deputy director there, and I'm overseeing strategy and planning work. And so one of the things I thought about, and thank you for inviting me on this panel, was how we have a lot of plans to do a lot of things on equity, and how do we really move into action. We've been doing a lot of evaluation, a lot of assessment. I'm sure a lot of folks are in some stage of that, but as you can see, Los Angeles has moved a lot into action. So I really wanted to think about how are we moving into action, and it helped me actually think about where we need to push a little harder to really get there. I wanted to just check before I go into it, just to kind of get a sense for who's in the audience and see whether there's some things I need to explain, like acronyms and things. I know we have kind of a mixed range of folks. So how many folks are from a CoC or are working in home systems or programs? Okay. How many folks are more in the affordable housing, lending, development? Okay. Anyone else, other folks that I'm missing that are here? Funders? Okay. Hi. So that's helpful, thank you. So I thought maybe we could do a little bit of, if I'm saying things that are a little acronym-y, please, or jargon-y, please stop me. So I wanted to talk a little bit today about, first, homelessness in San Francisco, but as I said, I'm really trying to sort of think about, well, what can we be doing and what can CoCs be doing in terms of actually moving from assessment, evaluation, and into action. And so, and it's certainly a struggle. We are really at the beginning of this, and we're in many stages of this in San Francisco. I wanted to just point out a little bit of our data. This is from 2019. We did just do a 2022 pick count. We don't have the data yet. But because of COVID and a number of other things, the last full unsheltered count we did was in 2019. So we're flying a little bit blind in terms of really aggregated data. We're using our regular data, our systems, coordinated entry, and our kind of, our HMIS data. But this is our unsheltered numbers as of 2019, and the darker green shade there is our folks who are unsheltered. And I wanted to just really talk about the impact of racism of homelessness on homelessness in San Francisco, and similar to many data points across the state, when we look at the impact of racism on homelessness, San Francisco, the 6% of our general population is Black, 38% of people experiencing homelessness in San Francisco are Black, and there's also significant overrepresentation of other BIPOC and LGBTQ plus populations in our homeless population. And so those are extreme disparities. So I just wanted to start with this. I know that we are pretty familiar with why homelessness happens. Many of us have been working in this from different angles, but I think it's just good to sort of start here to frame what we're talking about when we look at data like that. So why does homelessness happen? I talk about it in structural factors. These are simplified. It can be more complex, but really it's skyrocketing housing costs, inadequate wages, and systemic racism and other structural inequities, which make the first two much more, the disparities much greater, right, in housing cost and wages. And so when people ask, why does homelessness happen, I think that these are the three main things I usually say, especially for folks who don't work in our field. And so I talk about housing costs and inadequate wages, as I'm sure we all do, to really center the conversation on not the individual, but the systemic factors, so that we're taking away the idea that this is the fault of individuals, that people experiencing homelessness have characteristics that are different than others that cause them to be homeless. Really, we know that by and large, these are systemic structural factors that really make homelessness rise, especially here in California. For a long time across the country, we were seeing decreases, right? But when you started to look at expensive cities in the last 5-6 years, for 4 or 5 years, we're starting to see those numbers climb, especially unsheltered homelessness. And we know that this is a Zillow study. If you haven't seen this data, it's really helpful data. This is from a few years ago, but the Zillow economic research part of Zillow has tons and tons of this administrative data, shows homelessness climbs faster when rent affordability reaches 22 and 32% thresholds. So that 30% threshold is legitimate. It's a valid threshold that we use, because once we start ticking above that, we see that there's an increase that I think in LA, this data said that for every 5% increase in rent in Los Angeles, at least this was about 3 years ago, before the pandemic, it basically amounted to 2,000 more people experiencing homelessness. And so in communities like San Francisco, and I'm sure many of yours, that really, really correlates strongly with people losing their housing. And so systemic racism, I know that we have, again, probably really addressed some of the conversation around this in many ways, but I just wanted to mention, because again, I think it's important to contextualize that data and that disparity, that the data shows 37 or 38% of people who are Black experiencing homelessness because of systemic historical factors that have been present for the history of our country, that are, and many intentional government interventions and many private interventions that caused things like discriminatory policies around housing, segregation, land use, property rights, criminal justice, healthcare. Home ownership is one of the ways we build assets in this country, and we have denied people that for many, many generations. And so as a result, these racist economic and housing policies have really caused communities of color to have disproportionately high rates of homelessness. And so again, these are San Francisco's numbers, but I think that it's important just to talk about, when we're talking about equity, it's really requiring not just looking at our data, as I know we're all doing, but really requiring deep investments in capacity, as well as in capital in communities of color, that including brick and mortar buildings. It's not just sort of about, I'm a city funder, so providing grants to providers are important, but also actually investing in those communities in really sort of sustained and deep ways. So I think that the disparate impact of racism on homelessness, what we can do is what we're all, in the middle of. And many people have been, and communities have been doing this for a long time. Some communities are newer to this, and I think there's usually a mix, right? Some agencies are in your community have been really talking about this and thinking about this and doing things about this for a long time, and some are newer to this. And I usually try to say that we, as a homeless system, we have the responsibility to make sure that we are not perpetuating those disparities, right, through our own homeless systems and programs, and having a further disparate impact on people. And as you just heard from LA, our data, when we look at it, sometimes really is going to show what we are actually perpetuating and making it worse, essentially. It might not be intentional, but we have to sort of figure out what we're doing. And it's not always going to show up in our quantitative data. A lot of it's coming out in really talking to folks, looking at our qualitative data, and really talking to people who are experiencing homelessness or have experienced homelessness to see where the things are happening that we need to respond to and change. And to actually advance equity, so to get past just, making sure that we're being equitable and not furthering disparities, we have to design systems with the goal of reducing these disparities, right? So that's sort of really making sure that we're not sort of, when we think about equity and we say we want to prioritize people at about 37%, of people who are Black and experiencing homelessness, make sure that we are prioritizing the same amount of folks into housing. But if we want to reduce the disparity, we want to prioritize and figure out how to house more than 37% of people, or we're not going to be able to actually reduce that disparity. So I just put things in these three buckets. These are some of the things that we're doing in San Francisco, and I think similar to LA's, and I wanted to write down everything that LA was saying, thank you, and I want to bring you to our community. In terms of assessment, action, and accountability is kind of how I've divided these up into sort of areas of activity. We do have to do some assessment, right? And I struggle with knowing how to sort of move forward even if we don't have all of that assessment and evaluation. It's important, and I think it's really ideal, but we don't necessarily all have the sort of resources to do that or even the time to do that, right? So you have to balance the assessment piece, but we also actually, like LA, had the National Innovation Service come in and do an assessment of the Department of Homelessness. So really looking at what we were doing internally as a department, even just within our own staff, because we know that that is also going to really cause all kinds of impacts in the way our staff are working with our provider partners and the community and people that we're serving. So we developed recommendations from that, and I'll talk about that in a second. We have a Department of Homelessness Racial Equity Plan. So our Mayor, London Breed, asked, in 2020, late 2020, had all of the city agencies develop their own agency race equity plan. So there's an internal agency plan for every department in San Francisco. It's very, very long, has a lot of different things, much more related to things around HR and staffing and really making sure that we're being equitable in our city functions. And then we also are looking at things like our HMIS data. We're doing a coordinated entry evaluation. A lot of the things that you're probably familiar with and are probably doing or have done. PSH retention is another area. We're really seeing the recidivism rates being higher for people who are African American and also people who are transgender and gender diverse. We're seeing real disparity there, both in prioritization and in retention. So we know that we have a lot of work to do there. And so looking at our outcomes, our retention, who is coming back in, all of those things are important. And sometimes we don't have all that data. San Francisco does not have all of that data to look at. So we're really trying to put together what we have and make some educated, informed plans. In terms of action, we are now finally able to implement some of those recommendations. COVID obviously slowed a lot of us down, a lot of capacity issues to actually do the work. We're implementing recommendations, and I'll talk about which ones those are, but really importantly, one of the main recommendations that comes across everywhere that we looked was creating opportunities for people with lived expertise to participate in all levels, decision-making, design of programs, any of the assessments that we're doing, but really kind of having people at every level telling us and really working with us as partners to guide us in many of the decisions we're making. So not just sort of focus groups and listening sessions, but really trying to figure out how, and that takes a lot of work too, right? How do we resource that? How do we really support people to be able to do that? and make sure that we're really authentically engaging people so that they are able to participate in this way. Establishing equity goals and strategies, that's a tough one, I want to say, because establishing the goals isn't so tough. There's a lot we want to do, but figuring out how, where should we focus? How do we measure those things? People have agency level goals, staff level goals. We actually have homeless response system housing outcomes. So that's kind of where we are right now in trying to figure out what should we be looking at, and how do we really make sure we're measuring progress. Designing and funding programs that prioritize reducing disparities, so really thinking about who are we funding, how are we supporting them to do that, are we building capacity, are we throwing a lot of funds at certain providers who maybe need a lot more capacity building in terms of financial infrastructure, administrative infrastructure, sort of helping them scale up. And funding capacity building, as I said, and investments in communities of color. Accountability, again, a sort of piece that we're just thinking through, designating oversight bodies. So we have a lot of oversight bodies. We have the CoC board. The department has an advisory group called the Strategic Framework Advisory Committee, which is a number of leaders from across the community representing the homeless response system, who also want to be sort of really involved in the work. This is work that needs to happen across the community, but how do you centralize that in a way so that we're kind of really working together instead of sort of in disparate kind of pockets? And that part, I think we still have a lot to figure out there. We're in a strategic planning year, so we're trying to really look at our governance and oversight and see kind of how this work cuts across all of these different groups and figure out kind of where we should really make sure that oversight and accountability is happening. And we're starting to do more public demographic dashboards, putting up our CE data through demographics. How many people are we prioritizing? Who are we prioritizing? Assessing, housing placement, and making those public and looking at them regularly. We weren't really doing that until very recently, and we're trying to now do that for all of our programs so that we can at least see and everyone can see what's happening. And so we can look at that data to really make decisions about where we need to focus. This came from the NIS report. This is just some sort of, these are lanes of action, essentially, of things we should prioritize. Building community relationships rooted in equity, and that means really much more authentic collaboration and partnership across our system, our providers. That came up all over the recommendations and all of the findings. And really, again, this authentic collaboration with people with lived experience, that's what I was referring to earlier, really thinking about where are we actually supporting that kind of engagement and making sure that that's a consistent, deep engagement over many of our systems. Of course, equitable outcomes for systems operations. So one thing that's coming up a lot, I'm sure this is happening in your communities, is pay equity. Pay equity for our providers, pay equity just across the board, and really figuring out how are frontline staff able to, especially live in San Francisco, how can we expect to have diverse staff and diverse leadership when we have incredibly high housing costs, even for staff? How do we make sure that there's equity? And as a city department, we have a lot of things around unions and city sort of job classifications. This is new to me as well, but trying to figure out really what does it look like to really have equity in a way that is meaningful and supports our providers and our staff. And then housing outcomes, right? So this is increasing housing outcomes, permanent housing exits, and things like that, really looking at through racial demographics. I'm gonna just go right to sort of more action. I wanted to just highlight one program that we have. This is sort of an approach we're starting to take where we're doing a program by program approach. So we didn't do a lot of evaluation here. We just had to get those EHVs out, right? Everyone had to get those emergency housing vouchers out. We had just a few months to plan. And so we knew that we wanted to address racial disparities. We knew we wanted to operationalize that in some way. And we set some goals around it. And so our goals for our EHVs, we have about 900, addressing racial disparities, and setting targets around really, like, do we want to get to 40%, 50% of people who are disparately impacted in terms of getting those vouchers into those households' hands. Reducing homelessness, so we really targeted literal homelessness, which is another way to reduce disparities because people who are unsheltered and literally homeless we have such high disparities there, and increasing inflow by helping folks who are at imminent risk of homelessness. And so we really wanted to fund housing search services fully and stabilization services so that we could make sure that people experiencing homelessness, especially folks who are disparately impacted, are going to be able to actually find that housing and stay in that housing. So we had to find a lot of services dollars. Luckily in San Francisco, we have a local tax ordinance on homelessness that has helped us tremendously in doing that. I wanted to say one sort of, and I think we're going to get into this when we have a discussion, which is how do you prioritize race when you have fair housing stuff, right? And there's a lot of vagueness around what is fair housing, what is not fair housing, and how can you use proxy data or proximate things, just factors, really to figure out how we prioritize people. And so what we did was we looked at these are our districts in San Francisco. We chose the districts with the highest percentage of people who are experiencing homelessness that are Black and unsheltered. And that's where we directed our we said 40%, we set a goal of 40%. Really, it's been higher of our vouchers. And so we worked with providers who are in those districts, because those are the folks who know the people in those districts, already have trusted relationships with people in those districts. And so instead of sort of trying to get people to from one part of the city to serve other folks in another part of the city, we really heard providers say, we know our folks in our community, plus folks in our community want to stay in our community, right? And so that was a big piece of how we really designed the voucher program. I'll talk a little bit more about that, but I want to say just right now, we have not gotten all the vouchers out, but about 50% of our voucher, about 50 or 60% of our vouchers of applications are through. 92% of them have been BIPOC household applicants, so we feel like the targeting is working. It's hard, we'll see at the end of all of this about housing placements and how that went. But 56% of applicants are Black households, and so we sort of surpassed some of the goals we set. We should, that means we should sort of keep raising those goals and pushing ourselves to do more. But I wanted to just say that this is sort of telling us something. We don't have an evaluation going on, but we're seeing at least that the applicants, and 99% of applicants are getting approved. So we feel pretty good about this. And we can certainly be doing more. And like I said, some of the strategies we're contracting with BIPOC-led and BIPOC serving, majority BIPOC serving providers who already have expertise in their own communities and serving folks and relationships. Our city outreach workers, they're fantastic, but they don't have all the reach in some of these communities that we need to have. So there's a lot of people who don't feel comfortable or they don't trust us to engage for very good reasons. And so we partnered with people on the ground to do the outreach and really lead us and broker those relationships. So people in vehicles, people in tents, to make sure that we were reaching people who aren't going to come into coordinated entry, who aren't even going to really want to talk to our outreach workers. And so that trust and those relationships and that expertise that the community providers have, we really wanted to make sure that we were following that. So we targeted those vouchers to those districts. We're tracking data on demographics every week. We're going to philanthropy to really help us support those providers and making sure that they have the capacity to scale in the way we're asking them to. And that is just some of the ways we're approaching this particular program, but we're seeing that maybe this is a good model for some of our other programs. I'm going to stop there because I know I'm already probably way over. Thank you.
Thank you, Cynthia. And then next up, we're going to have Tamara Kohler from San Diego.
Well, thank you. I've known Cynthia a long time, and I always dread following her. She is so knowledgeable, and I've always enjoyed working with her. She's a dear, dear friend. I'm going to actually talk a little bit about our organization as the Continuum of Care for San Diego. It is the entire county that we serve. So about 3.5 million people. And so we kind of have and 18 jurisdictions. And so as a continuum of care, our focused approach is really a large geography and a lot of cities. We have 4 housing authorities in that space as well. Just going to tell you a little bit about the Regional Task Force. Here, I'm going to let you... I'm not a good multitasker. So the Regional Task Force is a true nonprofit organization. We're not a joint powers authority. We're not seated in government. So we are a true 501c3. We are the planning body. We do have the HMIS, the coordinated entry. We do the point in time. We do all of the continuum of care work. We have a really strong, involved 31-member board. I have my 2 largest housing authorities on it. I have my health plans. I have developers. I have housers, I have service providers, we have healthcare, I think I said that. We have elected officials. One of our county board of supervisors is our vice chair. We have a city of San Diego city council member that's on it. But most importantly, we have individuals with lived experience. And they ground our work and are important in our committees. And it is our singular goal as a regional task force is to ensure that should a person experience homelessness in the San Diego region, that it is rare, brief, and non-reoccurring. Our goal is to end homelessness, but every day we have to address it. So the importance of shortening that length of time, trying to prevent or divert, and that it's non-reoccurring, and that they stabilize in housing and thrive. At the RTFH, I'll just say that we're grounded in the truism that homelessness is a solvable problem. Housing is what solves it. So all you housing are our solution, but we need to coordinate well with you to make that homeless experience rare, brief, and non-reoccurring. We also believe that all people can be housed with the right level of supports. Pretty simple. We believe housing is a basic human right and need as well. Like so many organizations, we have been working on the racial equity work from, we started looking at data in 2018 and 2019. But as our country really stepped into the challenges in June of 2020, our organization put out a statement, like so many others, but I just want to give you some really important parts of it. We said we would rally our collective voice to listen, learn, and act together to pursue racial equity and work to end the system injustices that result in homelessness. We were committed to addressing racial inequity and amplifying the perspective of people of color with lived experience in our work, our communication, and our organizational decision making. Really, really important that we centered that in our work, and then we got to work. We'll go to the next slide. As I said, we did the racial disparity reports in 2018 and 2019. We also did some pretty significant training and a presentation on racial disparities to our membership and our board. And in January of 2020, kind of pre-pandemic, we had adopted a regional policy and guidelines for addressing unsheltered homelessness in encampments, really trying to address the needs that we saw. In July of 2020, after our statement, they approved the recommendation of an ad hoc committee to address homelessness amongst Black San Diegans. I'm going to pick up this last one on my next slide, if that's okay, Lahel, if you want to go to the next one. The importance of the advisory committee really determining that we needed an ad hoc committee to address homelessness among our Black San Diegans really came from our data. Just like in LA and San Francisco, our data is enlightening and troubling at the same time. 21% in our 2020 point in time count were Black San Diegans, made up our unsheltered population, and over 30% of our sheltered population. And in San Diego, it's 5.5% of our general population. So not only were they overrepresented, but we knew we needed to really work on the cause and effect of it. So we were exploring the factors contributing to the disparities. Was the purpose of the committee to listen and engage in extensive public dialogue, not only with community stakeholders, not just the providers, but Black San Diegans experiencing homelessness, and to develop a series of recommendations that the CoC could take to better address the impact of the systemic racism we were seeing in our homeless crisis response system. What we saw in our data, though, was that there was not only a significant overrepresentation in our homeless population compared to our general population, but it was also at the entrance into homelessness. We were seeing them enter homeless at these high levels. Our housing was about the same as what we were seeing in our system. So we were housing at the right level, but we really needed to work on the front end of it. For far too many San Diegans were experiencing homelessness that were Black, and the disparities really existed in all of our subpopulations. So families, veterans, youth, and individuals entering the homeless system at greater rates, although being housed at about the same. And although the disparities existed, one more, go back, one more. In the homeless population, we did see that once they were in, they were being housed. But we thought, data only tells you so much. So one of the things when the committee came together, I'm going to share a little bit about the formation of the committee because I think it's really critical. We had a lot of people interested in being a part of our CoC committee. We had 2 chairs that were members of the advisory board who established the committee and those that participated. All Black San Diegans with different levels of engagement and importance of lived experience. We had housers, we had some that were in government, we had some that were in policy, we had youth, we had family representation, we had those that the system worked for, and we had those that the system was not working for, all represented on this committee. A couple things that as the Regional Task Force as a nonprofit did, supporting our Continuum of Care board in this committee is we offered a couple things. We staffed the committee, as we traditionally do. I, as the CEO, only come when invited. The work is the work of the committee. We offered to support financially someone to facilitate this committee, and we proposed 2 real experts in this field, Darlene Matthews and Michelle Williams. We felt like the work was important enough to have the best experts in the field to come and help and support that work. One of the real key things that they did is we took the data and then we took the experience of people on the street. This committee framed up what would be their goals and their interaction. Go to the next one. And so here are the 4 themes that really emerged across our subpopulations, that being Black impacted your access to the crisis response system. Not only is the data showing that, but this committee set up an engagement throughout our entire region with people experiencing homelessness, Black San Diegans. And Darlene and Michelle, along with members of the committee, set up the community meetings. We provided the gift cards, and they had some really powerful and troubling conversations in our community. So not only did we know that it impacted their access to the crisis response system, what we heard was their inability even to understand the system, how to access it. So even though our data showed significant disparities, we also know our data is not capturing everyone who is a person of color in San Diego, because many of them can't figure out how to get into the system because they struggle to understand where those doors are. People didn't seem to understand or have full information on how to get housing either, and felt like they didn't get the level of support and knowledge, nor were they treated equally or equitably when they sought assistance. So filling out things like the housing choice vouchers and others, we found that the staffing, although we have a very diverse staffing throughout San Diego, very few were Black San Diegans. And so they felt like it was really important to have that representation. It can't just be someone of color, it's got to be someone of my color that understands me and can have those conversations to build the trust that was needed. And those were hard-heard conversations. We also heard the impact of things like a foster care system. We had a veteran that we talked to in his early 60s that was still struggling with housing stability because of his experience in his foster care system. We also learned that the mainstream systems didn't actually know how to engage people that were Black San Diegans, and they were confused about what mainstream services were available and how to even understand or get interested. They felt like many times they had to prove their eligibility. So really important. So the data was telling us one thing, but the experiences were telling us the hard truth. Not only do we know he wasn't capturing everybody, but the challenges that exist. And then the lack of equal treatment in our homeless programs. Some places we would see that is individuals taking longer to find landlords that would lease up to them and accept their vouchers as well. Go to the next slide, please. So it's important to know that we are a policy organization. And as a planning body for the Continuum of Care, not only do we promote the community-wide commitment to the goal of ending homelessness, but how important it is for us to focus on policy and advocacy, and how fortunate we were to have the emergency housing vouchers not only come nationally, but to our community at a time when we had a committee that was really leaning into this. And so the committee made some really important recommendations. Those recommendations were brought to our Continuum of Care board, which had the 2 largest housing authorities on the board. And some of those recommendations were, how could we prioritize people of color, Black San Diegans, for a greater representation, knowing that there's a challenge of fair housing, and would it be a fair housing violation? Our board actually approved unanimously those recommendations, with one recommendation to us as the continuum of care, that we would take their recommendations and their concerns and propose that to HUD as a policy issue, that it was something that we needed to change, that we knew that systemic racism and years of policy had really set Black San Diegans and others at a place where it was an unfair disparity and really almost like a disabling condition. And through that, we've been able to move that through HUD in a way that hasn't been done before. And the Center for Policy and Budget, or the Center for Budget and Policy and Practice, reached out to San Diego and our committee and said, hey, we want to track how your emergency housing vouchers are going. First time they've ever done that. Usually people engage them, and they engaged us. And so it's really important that our committee is able to walk along with a national policy body to change the national policy. We have to change the way that we do business. And because we have such a large geography, we weren't able to target like those zip codes in a way that San Francisco did in such an important way. And I think the importance that we also learned to center and address the needs of our most marginalized, whatever they look like in your community, and to reorganize, and to recognize humanity and advancing equity and opportunity for all. I think it's really important as we lean into what housing justice is going to look like, that we really get our arms around that we need to change policy. And all this work has been really rooted in the experiences of people with lived experience. I think it's, we talk about how we're going to change those. We look at the data and we do all of these things. One of the most powerful things that we have in our community is those who will share their experience with us, who trust us with their stories and their experiences. And so I want to share with you and turn my time over to Curtis Howard. He's from San Diego. He's on our committee and is, educating us every day about his experiences. And so we felt like, you saw a lot of data from LA and San Francisco. So there's nothing more powerful from hearing from someone in the room who has literally opened our eyes and walked us through this and is powerful in his approach. So I'm going to give it over to Curtis.
All right. My name is Curtis Howard. I am currently a lead organizer for All of Us or None. San Diego chapter, All of Us or None, is a prisoners' right and formerly incarcerated advocacy group for formerly incarcerated people and their families. I'm also a two-time published author, and I've written 5 books. I wrote those books in prison. I'm also currently a lived experience consultant for RTFH. San Diego. And, first I wanted to say, when I was coming here and I found that I was going to come to this conference, I was getting ready to, I was thinking of what I was going to wear, and I asked Tamara, I said, I asked her and LaHayla, I said, should I wear a suit? I said, I'm going to wear a suit, and I got this 3-piece suit and I put it in my luggage. I said, maybe I'll wear this the vest and the pants with the tie. No, I'll just wear the jacket with the tie and leave the vest out. And I said, I don't have time for this. I don't have time to be going. I got to, go over some of my notes that I'm going to be talking about. So I said, I'll figure this out later. I just put the whole suit in the luggage. And so as I was going through some of my talking points, that I'll be sharing with you guys today, one of those talking points hit me. And I went back in my room and pulled the suit out the luggage and hung it back up in the closet. And I'll tell you the reason why I did that. When I came home from prison, I struggled to find housing. And it was a back and forth struggle. I did not have supportive housing. Wasn't none of that coming into play. People weren't even considering that at the time. It was very hard to get into housing. So I did what people said, hey, don't sit back and say, woe is me. Pull yourself up by the bootstraps and make something happen. Well, I didn't even have bootstraps at the time like other people had, but I made something work, and I started working, and there were only 2 jobs that were friendly to formerly incarcerated people, and that was telemarketing and labor. So I went to work in construction, and, I got a good paying job. Then I rented an apartment. I got in there. Credit was good because I had been incarcerated the last 10 years. So I got into a place, but as soon as the project was done at the construction site, the job was over. And now I got this apartment, and the job is over, and I'm fighting to keep it for a few months. And then I went back into shared living. Went and rented a room in somebody's house, and then found a different job and went at it again. Got another place. Kept that place a couple years. That company sold. A few months later, I went back. Had to rent a place in a sober living and a room in a studio, until I got back on my feet. So my brother, he said, man, you're going through this. He said, you've been to prison, You need to go apply for Social Security disability because, you're eligible for it. It's a disability that you've been to prison like that. And I said, well, how much do they pay? He said, it's $800 a month. I said, I'm going to stick with this minimum wage job. And as I was doing that, I kept falling on and off. And I said, maybe I can work this disability thing and supplement that income with a part-time job. I said, that sounds better because at least I have something to fall back on. So I went down to Social Security and I signed up. And they said, when you sign up, you got to see a psychiatrist first. That's your first step. So I signed up and I got the appointment. I went to the psychiatrist and he said, he talked to me, twirled the pen around in his hand and studied me. And then he said, okay. And he let me go. He said, in a week, you'll get a letter, let you know what's going on. So a week later, I got this letter, and it said, denied. And then he said, I talked to Curtis, he's been through some things, but he was fairly intelligent, and I think that he can make it if he really applies himself. Ran back to the telemarketing place, start trying to make phone calls to get sales again. Did that another 6 months, I got beat up. Still couldn't get out of that room that I was renting in that house. The person who rented the other room had loud parties. They were doing drugs. This is not a place for me to be. So I went back down to Social Security again. I applied again, and they gave me another appointment. I went down there again, talked to the guy. He studied me. A week later, I got this letter. It said, denied. Said, I talked to Curtis, he does have some mental issues going on as a result of his experiences, but he seemed healthy and he didn't have any underlying health conditions, and it seemed like he could actually make it out there in the workforce. So I went back to my brother. I told my brother, I said, man, this is not working. I said, man, they not messing with me. And he said, you know why, man? He said, because you keep going down there, man, and you're telling them this story, but they can't, you don't look the part. I said, everybody judges you. They look at you and they judge you based upon how you look, skin color, all these different things. It's like an appearance. It's how people judge you. And he said, man, you down there, you talking to this man, you sounding all intelligent, and you got all this sense, you got, you're dressed and everything. And I said, oh. So I signed up again, and they gave me an appointment. I let all the hair on my face grow out. I put on some oily jeans from a auto mechanic. They were like 3 sizes too big. I tied them up with a rope. I put on some flip-flops with my feet out, no socks, and I went down to my appointment, didn't brush my teeth that morning, didn't gargle with Listerine or nothing. I walked in the office, and he looked at me, and he said, come in. And I walked in, and I said, hi. And I just waited, and it hit him, and I seen him choke up and tear up. And he looked at me, and he said, what's a good mailing address to send your checks to? And I said, wow. I said, you're giving me a check? He said, well, I'm not just saying, I'm just saying in case I approve you, what's a good address to send your checks to? And I said, oh, okay. And then he went through the rest of it as a formality with me. A week later, I got a letter, approved. And I said, wow, why is they judging me like this? You know, I had to go through this, what is this all about? So I said, I'm gonna need some help because the Social Security's not enough, and I'm gonna run down to the welfare office, and try to get some help from them. And when I went down there, I was like 10 minutes late. And the lady looked at me when I walked in, and I pulled my phone out, my cell phone, to cut it off so I wouldn't be interrupted. And she said, oh, cell phone. She said, hey, how much that phone cost? She said, who pays the bill on that? I said, me. And I said, well, I wasn't expecting this because that was a psychiatrist I was seeing before. They're supposed to study you. So I said, I'm done with that. Now I can go back to me. But I couldn't. And then she looked at me and she said, you got some nice clothes on. She said, how can you afford that? What's going on with you? I thought you were homeless and all. And I said, wow, she's doing the same thing. But then she hit me with another thing. She said, you're 10 minutes late. She said, why are you 10 minutes? I said, well, I had to catch the bus and I missed the first bus. And I had to wait like an hour for the bus. So even though I had an hour cushion, I still ended up just 10 minutes late because I did have some cushion time. She said, you know what? She said, there was this white guy who came here a couple weeks ago, and he applied for the same thing. And you know what he did? He camped out in front of the building to make sure that he made his appointment. She said, that white guy camped out. She said, that white guy. She didn't say that guy. She said, that white guy camped out to make sure that he made his appointment. And you know what I did when he did that? I signed his papers right away and signed him right up because that white guy, so that let me know that I had an additional problem beside all the problems that I had to deal with, that I had also this problem with race as well. So to go back to this, so it's kind of self-explanatory by now, the reason why I didn't wear the suit is because the things that I was going to share with you, I didn't think that you would take it to heart if I was sitting up here looking like I didn't go through it. And I said, I got this audience, I'm going to be telling them that I'm homeless. I'm going to be telling them that a year and a half ago, I was in a COVID hotel at the onset of the pandemic. I was in a COVID hotel. I didn't have COVID, but I was homeless, and they placed us there because we were at risk for getting or spreading COVID. And even though I was still with All of Us or None at the time, I was homeless and doing advocacy work, going to meetings and out there marching on the streets, protesting and doing advocacy work and going back to a room, So I said, if I wear this suit, they're not going to be able to picture me. They're going to do me the same way that guy did at the disability office. They're going to say, I'm having problems with Curtis right now with this Armani suit on, telling me how homeless he was, a year ago. He's got on some Florshams and an Armani suit, and it's hard to picture that, So people place us in these things where they picture us and they judge us based upon these looks. And I feared wearing that suit because I wanted to get across some things to my audience, and I felt that it would spoil it for me. But I also realized that in my quest to obtain housing, that I have problems in housing like everybody else has: credit checks, application fees. But for every housing problem that there is for the average person, there's another one for me being black. So you got application fees that people are charging every time you apply for a place. I can't afford $40 or $50 every time I apply for a place, and I'm low income and I got a housing voucher, and you want me to pay $40 every day that I go look at a place? That's like $200 a week, that's $800 a month, So that's a problem that a lot of people have But as a black person, I have a problem with things like redlining, that apply to me, where I went and looked at a place before that a landlord showed me. And I walked out of the place, I said, I'll pass. And he was like, the nerve of him. How does a black guy pass on a place? I give him the opportunity and he passes. Only white people can pass on places, So I walked away and he called me that night. He actually called me and said, Curtis, can you tell me why you passed this place? I just got to hear this, And I said, man, your place reminded me of the Flintstones. It was like you didn't have any upgrades. Because he told me, be serious, be honest. It won't hurt my feelings. I said, okay. And I said, man, your place looked like bedrock. I said, you didn't have your cabinets were like, they were dull. You had no upgrades. You didn't have hardwood floor. You just had a floor. It was like concrete or something. Your walls looked gloomy. Your place wasn't painted. Your outside of your place was all dirt. You didn't have, he said, oh, okay. He said, that's what I wanted to know. I said, but now look. I said, I looked and I see you have this other place. On the other side of El Cajon Boulevard, which is like two different cities. It's like on one side of El Cajon Boulevard in San Diego, it's like hood. On the other side, it's like Beverly Hills 92101. So it's like, I'm like, how does this happen? But you never see anybody come close to this side that lives over there. So I said, you have another place and it's the same amount. It costs the same. I said, I want to check out that place on the other side. And he starts stuttering. That other place, we require a little bit more. No, I said, it's the same price. He said, yeah, but it requires a credit score to be a lot higher for that. Why? It's the same price on the same place. So I said, I saw the redlining. And I remember once when I did get a place when I was working, I went and they gave me the place. They said, okay, you can get this place. And they said, okay, and it was in a nice area. And I said, man, I came up, this was, I got it, And the landlord called me a few days later before I moved in, and he said, hey, you got this place already? He said, but Curtis, let me tell you this. He said, I got another property over on 38th Street in the hood. And he said, he said, man, this is a great place over there. He said, you never saw it because this was the first place you came to and you chose pretty fast. He said, but you really need to go see the other place too. I want to give you an opportunity to do that because there's some great people that stay over there. He said, man, there's this black guy named Jamar. Man, that guy is so cool. Man, you got to meet Jamar. That guy is so cool. And I said, yeah. And he said, and, we got this other black guy, he works down at the shipyard, minds his own business, really great guy. I think you really like these guys, man, and it's a real nice atmosphere and a nice place. I was like, wow. I was like, no, I think I'm going to stay. I'll meet Jamar later. I'm going to go ahead and stick with this place right now. So I noticed, that in my quest for things, it's not only the things and the obstacles and barriers that I faced associated with housing, period, and then being formally incarcerated, then there was another set for being black. So when I got the opportunity, when Tamara Kohler here gave me the opportunity to address the racial disparities of black homelessness, I came straight over, to do that because they were one of the organizations that truly cared. I said, somebody's really wanting to address and really wanting me to talk about that. Do you really want me to talk about this? Because I'm getting ready to hit you with some stuff, man. You guys going to be really uncomfortable up in here, And they invited me in that room, and I dropped a couple bombs on them, and I was waiting. I was waiting for him to say, you know, maybe this committee's not such a good idea. We don't want to re-traumatize people, you know. But, you know, they sat there and they said, go ahead, bring us, tell me more, you know. Do what you do. No, you do it. You know, going out there, what do you think we should do? You know, give me the idea, we're going to do it. You know, it was like, wow, now this is real right here, you know, this is what we need. And this is why I was grateful to be associated with the RTFH, because they truly address the things that really impacted me personally in my community as well, you know. And they give us the opportunity to get out there and to reach landlords and people and to get it from lived experience people. Because a lot of these agencies and housing providers, they don't listen. They don't listen to lived experience people. I wanted to tell you about a place in San Diego. It's called the House of Metamorphosis, the most successful drug program in San Diego. Staff from the House of Metamorphosis can walk into a courtroom to a judge and say, let them go, I'll take them, we'll take them. And the judge will say, let them go. Because they're so successful at what they do, at changing lives and getting people off the drugs. But you know what the CoCs is? They're all lived experience people that work there. All of them are former addicts themselves. The best and the most successful program in San Diego. And what the RTFH realized is that they said, you know, we don't need to just talk to lived experience people. We need to have lived experience people on our staff and involved in making decisions and all. And that's the key. You can't just listen to people. You got to have people leading. You got to have people in organizing positions, and you got to have lived experience people if you want to, as part of staff. Because right now, we're at a time right now where all the voices are demanding to be heard. Since this pandemic, there's been a lot of stuff going on. We had the Black Lives Matter movement, we got the LGBT community, everybody's yelling, we want in, we want to be heard. And right now it's that time. And if your housing provider or if your agency or organization does not have lived experience people involved, they're going to cancel you. We're at a time to where you're going to start being canceled because you don't have these people with you. I can't go to you if I can't see anybody that looks like me or somebody that had my same experience. And that's definitely what we need, and that's like a fair warning to everyone because I see it. We see what's going on right now. We're evolving right now to where these voices need to be heard. But if you're smart, you're going to do it anyway. If you want to succeed in this, then you need to talk and you need to have people like us involved. And I'm so grateful for RTFH for taking that step ahead of time to form these groups and to address Black homelessness and all the other things that they address that involved lived experience. And that's it. That's all I have to say for today. Curtis Howard, thank you.
All right, I don't know if I can say anything after that. Thank you, Curtis, for sharing your truth and your story, and we're so glad to have you with us here today. So we have a few minutes left, actually. If there are any questions, I was going to pose some questions to our panel, but I would like to give the audience an opportunity to ask some questions of our panelists. I think we still have Clifton joining us virtually. Yes? Okay.
Maybe there's one here, too.
All right, we got some hands up.
Hi, thank you so much for this panel. It's very informative. My question is, I know Clifton from Los Angeles talked about the VI SPDAD and some of the changes that are being made. So I was just wondering in San Francisco and San Diego if that was the same.
So I'll just say, yes, we're changing our coordinated entry. I think we need to get away from even a named assessment to really assessing what is needed in the community and what the people are experiencing. The VI SPNAT is a great tool, but it was never created to really move people to housing. So we have a whole other coordinated entry tool that now is really on our housing resources and the needs of people experiencing homelessness. And the VI SPNAT's only about 10% of that.
Oops, no, my fault. So we actually, in San Francisco, have never used the VI SPNAT, but we did have so we had sort of a homegrown tool developed with a consultant and with input from the community that we've used for a few years, and it's been moderated over time. We are looking at it now just to see, because we're seeing prioritization and assessment seems to be fine score-wise, but actually I think a lot of what we're learning is from talking to people. So we're doing a coordinated entry evaluation that is very heavy on the qualitative side. So really trying to talk to people who've been through the system and trying to talk to people who have not engaged with the system before or haven't or had an experience that meant that they were not going to engage again because the system had failed them in many ways. And so we're trying to understand really, again, how to move away from the assessment, like how important that score is. We all have to do this prioritization because we don't have enough housing to give. So we have to figure out, what we're trying to figure out is how to prioritize or really serve people's needs who are in front of us, look at their housing barriers, and try to figure out, instead of sort of putting people in buckets. It's we don't have the answers, but that's what we're also trying to figure out.
I'll just add one more thing. We're actually trying to house at all levels. I think one of the challenge of coordinated entry and prioritizing people is only working the top of your list, where with different housing resources, we're trying to look at, prevention, diversion, first-time homeless, shallow subsidies. Like, let's just house people in all of these things while prioritizing for our most scarce resources. So I think we just got to get to the business of housing with everything we can and with everything we have. And listening to people and what their experiences are and their needs, and get away from some singular assessment telling us that that's the best way to do the work.
Hi, thanks so much for this presentation. I'm just wondering if you could talk a little bit about the tension between like interim housing and permanent supportive housing and kind of, I guess, the status of that in California. I'm not asking you to take a stand, but just to discuss how that's been affecting your organizations.
Clifton, do you want to, I don't want to forget that you're there too. Did you hear the question?
To clarify, I think this might be what you're asking. Tell me if this is right. Whether communities are being asked to invest in a lot of different housing options, and I think what you're asking is there a tension between investing in interim housing options, so shelter, cabins, like those sorts of things like that are temporary versus something permanent? Is that, yeah. I think that I'd love for other folks to weigh in, but there shouldn't, it's not an either or, right? So it's this idea that it's a zero-sum game is one that we're just, it's a scarcity mindset that we're in, right? That we have to have one or the other. And if we had all of the things that we needed, we would get the right amount of both. So right sizing how much shelter we need, but for every temporary housing bed you have to include housing resources. You can't do one or the other. I mean, you can do permanent housing, but then people are unsheltered, right? So everyone doesn't have to go through temporary housing, but you can't just be building your temporary interim housing strategies without thinking about those housing resources. So you should think about, for every bed or every cabin or whatever the sort of interim housing unit is do I want to have people exit to housing every 3 months, every 4 months, and how many housing resources do I need to add to my system to make sure people are flowing through?
Ditto.
Same here. I would definitely agree. I think one of our focus is definitely throughput. And so a lot of what we're doing is sort of removing the CES in terms of assessment to allow folks to be able to enter interim housing in a seamless way and really connect folks to resources for permanent supportive housing. So it's not, one or the other. It's really just kind of having an abundant mindset in our approach.
So we are at 5 o'clock. Are we a hard stop? Is there any other burning question in the audience? Yeah, one more? Okay, we'll do one more. If no one's kicking us out, we'll keep going.
Thank you. Yeah, I wanted to ask Clifton and Cynthia, you both mentioned retention of Black people in permanent supportive housing and just retention with permanent supportive housing. Did those data and assessments capture evictions happening from permanent supportive housing? And did you see disparities happening in who was being evicted from permanent supportive housing or the reasons for those evictions?
Does Clifton want to answer that first?
Clifton, do you want to answer that first?
Yeah, I can go over some of the key findings from the report, but one specifically looked at housing discrimination as being really a key point. There wasn't so much specifics around sort of evictions, but more so about folks returning into interim housing or street homelessness, and which really showed that 1 in 4 Black single adults residents were really returning to interim housing and homelessness between 2010 and 2019.
Yeah, we're just starting to look at this in different ways. And one of the things we're looking at is just returns, because we don't have as much data from the supportive housing programs as we would like to have. We are seeing a lot of anecdotal data, and we are looking at eviction data. Now, our eviction data is covering also public housing and not just permanent supportive housing, so we're trying to parse that out. But essentially, again, looking at who's returning, and we know, of course, our systems aren't even capturing everyone who's returning. They have to come back to the system, right, to know that. So we're just, and based on what's happening in other communities around us, that the increase in the number of people who are coming in to the system and that disproportional number being so much higher for Black households, we're assuming in a lot of ways that this is something that we're going to have to, we should respond to even before we have all the data. So we're starting to really do that by talking to folks, looking at program by program data.
So nobody even asked this question, but I'm going to answer a question that nobody's asked. One of the things that I think has come out of the pandemic is not just the eviction moratorium, but also the rental assistance, and seeing that we can get a lot of rental assistance to people to prevent their homelessness. We also saw through the pandemic that all of our systems could be supercharged. We could get waivers on a number of the documentation and eligibility, and I'm just going to say that we should hold on to all of the wins that came out of that, all of the system improvement that we did, all the reduction in paperwork that we did, the caring about people, that they have a place to be safely sheltered and then safely housed, the way that communities rapidly move people into housing solutions and shelter should be something and a mindset we should not step away from. And I think the understanding that we can actually do this work and we can do it well. And for the housers in the room that have the concern over coordinated entry or how continuums of care can really lean into this work, we recognize how hard it is for you to cite these projects, to fund them, to get them off the ground, and that last mile of getting them filled and leased up so that you get your tax credits. I just want you to know that we hear that and we're getting so much better at it. In San Diego, our last lease up took 29 days. So I want you to know that because if we'll do that for you, you will create units for the Curtises, for the people that we're trying so hard to house. So I just want to leave us with, the opportunity to understand that we all need each other in this space, and we are looking at our systems. We are getting better at it. We're reducing paperwork. We're cutting down on the lag. We should hold on to all of those waivers and all of the funding that's coming both federal and state. Let's use it, every damn dime, to house people and safely shelter.
And with that, this session is done. Thank you all so much. Thank you to the panelists for coming and joining us. Thank you.